Otitis media is inflammation of the middle ear or a middle ear infection. Otitis media symptoms: when the middle ear becomes acutely infected, pressure builds up behind the eardrum, tympanic membrane, frequently causing intense pain. It may result in bullous meningitis. Meri means eardrum, which means that the tympanic membrane is blistered and inflamed. In severe or untreated cases, the tympanic membrane may rupture, allowing the pus in the middle ear space to drain into the ear canal. If there is enough of it, this drainage may be obvious. Even though the rupture of the tympanic membrane suggests a highly painful and traumatic process, it is almost always associated with the dramatic relief of pressure and pain. In a simple case of acute otitis media in an otherwise healthy person, the body's defenses are likely to resolve the infection and the eardrum nearly always heals. Otitis media treatment: symptomatic. Oral and topical analgesics are effective to treat the pain caused by otitis media. Oral agents include ibuprofen, paracetamol, acetaminophen, and narcotics. Topical agents shown to be effective include enoxaparin and benzocaine drops. Decongestants and antihistamines, either nasal or oral, are not recommended due to the lack of benefit and concerns regarding side effects. Antibiotics: deferring the start of antibiotics in acute otitis media for 1 to 3 days if pain is manageable with the above measures is currently recommended. 2 out of 3 children with acute otitis media resolve without antibiotic treatment. No adverse effect on long-term outcomes have been found when treatment is withheld. Antibiotics have significant rates of potential side effects, and a recent trial has found increased rates of recurrence of otitis in children, aged 6 months to 2 years, who were treated with amoxicillin. The first-line antibiotic treatment, if warranted, is amoxicillin. If there is resistance, then amoxicillin clavulanate, or another penicillin derivative plus beta-lactamase inhibitor is second line. While less than 7 days of antibiotics have less side effects, more than 7 days appear to be more effective. Among short-course antibiotics, long-acting azithromycin was found more likely to be successful than short-acting alternatives. Tympanostomy tube: in chronic cases with effusions, insertion of tympanostomy tube, also called a grunt, into the eardrum reduces recurrence rates in the 6 months after placement but have little effect on long-term hearing. Thus tubes are recommended in those who have more than 3 episodes of acute otitis media in 6 months or 4 inches a year associated with an effusion. Alternative therapies: complementary and alternative medicine is not recommended for otitis media with effusion because there is no evidence of benefit. There is an osteopathic manipulation technique, called the Galbraith technique, that can be done at home, which is intended to improve drainage. The technique was evaluated in one randomized controlled clinical trial. One reviewer concluded that it was promising, but a 2010 evidence report found the evidence inconclusive. Otitis media is a common disease, yet every individual needs unique treatment and care. We encourage people with otitis media and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about otitis media and how to treat otitis media, just click on the link at description or visit www.mainmd.com. Thank you.